Dr. Michael Wheeler, orthopedic spine surgeon. Let's continue our discussion about indirect decompression. Okay, we've made a couple of videos talking about direct decompression, going in there and directly taking the pressure off of them, or indirect decompression, where you're inserting a spacer in there in order to indirectly take the pressure off the nerves. We see that here in this bottom segment, that when we insert that spacer in there, how much room we can make for those nerves in there. Here are a couple quick hitting situations where I think indirect decompression can be very beneficial. Number one is where someone has some sort of spinal instability. Usually this is in the form of isthmic spondylolisthesis, where one bone is shifting forward on the other. Okay, so there is a bony malalignment causing a pistoning and a punching bag phenomenon on those nerves, that if you were to go in there and just trying to take the pressure off the nerves themselves, you haven't addressed the underlying reason for the issue, which is the instability. So by inserting that spacer and stabilizing the spine in the correct position, you have successfully indirectly taken care of the pressure on the nerves. A second reason is very useful for indirect decompression is in patients who've undergone previous direct decompressions. So they've had a previous clean out in their spine once or twice before, and unfortunately they're having recurrent pressure on their nerves. A lot of times going in for a third time to try and clean up all that scar tissue around those nerves, and it can be a bad idea. And you can indirectly take the pressure off the nerve by inserting the spacer in there, allow for a more reliable and safer recovery for the patient. These are just a couple quick hitting options. For any more questions, please let me know. I'd love to help out.